Hello guys, you're welcome back to this class. Today we are going to discuss the groups of diabetes in pregnancy. Yesterday we have introduced gestational diabetes mellitus, and we described what it means and how it occurs and why it happens to some women in pregnancy. So today we are going to look into the four groups of women that may be diagnosed with diabetes in pregnancy. Okay, so the first one is diagnosed pre-gestational. So this means that this person has diabetes that has been diagnosed even before getting pregnant. So the advantage of this diagnosed pre-gestational is that this woman can control her blood sugar depending on how she is compliant with the medication given to her. If she has actually seen a doctor because of this, so she will benefit from having a controlled blood sugar level before getting pregnant and while pregnant, even till after delivery. Okay, then the second one is undiagnosed pre-gestational. So these women, this group of women, they have diabetes mellitus, but they get pregnant. Before getting pregnant, they did not know that they have diabetes mellitus because they didn't check. So therefore, while pregnant, the diabetes mellitus may be diagnosed, but you cannot now say that it is before getting pregnant or it is caused by the pregnancy because she has already been pregnant for maybe up to 20 weeks. So the problem with this group of people is that they will have this diabetes and they will get the complications of this diabetes that can even affect the pregnancy. So at whatever it is being noticed or diagnosed, it might have caused problem to the baby. So that's the problem with this group of people. So as you can see, this first group, they already knew they have diabetes before getting pregnant, so they have the opportunity to take medications and control their blood sugar. So this first group is the best group of people among these four. Okay, then the third group is the pre-existing pathology or pre-existing disease. So this particular group of people, they have the disease that may be affecting the pancreas, not producing enough insulin, as we described in the video yesterday. So but the manifestation of the hyperglycemia has not come to effect. Okay, so the person is having the underlying disease, but there is no manifestation of the symptoms of the diabetes, so they will continue having this disease ongoing while they are pregnant. But then remember that in pregnancy, as we described yesterday, that it will increase the amount of sugar in the blood, therefore requiring a concomitant increase in the amount of insulin from the pancreas to move that sugar into the tissue. So when this is happening normally in that pregnancy, but due to that pathology, the disease condition that has been ongoing before pregnant, it will now show because there won't be enough insulin to be produced. And then remember that the sugar goes on going higher irrespective of whether there is insulin or not. So this group of people, they have the disease already before getting pregnant, but pregnancy will now make it to manifest. Okay, then this last group is the gestational diabetes mellitus itself. So this last group, these are the people that have the actual diabetes being caused by pregnancy. Okay, these people, how you know them is before getting pregnant, the woman must have checked her blood sugar and it will always be normal. Okay, so but during pregnancy, the sugar begins to increase. So this group of people, their own diabetes is caused solely by the pregnancy. So the good news here is that after delivery, this blood sugar level returns to normal. Okay, because once you deliver the child, all the other systems begin to reverse to normal. Therefore the insulin begins to go back to normal, the blood sugar begins to go back to normal. So after delivery, this group of people, their blood sugar returns to normal. Okay, so these are the four groups of women that will have diabetes in pregnancy. And remember, the essence of making this video is not just for you to know these four groups or to know where you're falling, But the essence of making this video is to advise you to check your blood sugar, so that if you have diabetes before getting pregnant, you will belong to this first group. Because this first group, they are already going to control their blood sugar before getting pregnant, and that's the best thing. Okay, because all these three, depending on when you make the diagnosis here, either this or this or this, depending on when you make the diagnosis, the hyperglycemia may have caused some damages. Okay, it may have caused some complications to the pregnancy. But this first group, they noticed they have diabetes before getting pregnant, so they start taking their medication early from their doctor, so that they control the blood sugar and have a safe pregnancy and safe delivery. Okay, so tomorrow we'll continue with the risk factors of diabetes in pregnancy, and that goes on. Okay, so consider following and turn your notifications so that you don't miss any of these videos, and then share this video to create more awareness. If you learn anything, please put it in the comment section, like this video, and then I shall see you tomorrow.